Welcome to the RadSound Medical Masterclass. Today, we're going to journey deep inside one of the body's most critical organs. Our mission? To decode the language of its blood flow using the power of Doppler ultrasound.
So, how do we map the river of life inside the liver? Well, I want you to think of the liver less like an organ and more like a bustling city. It's got highways bringing in supplies, cargo routes delivering nutrients, and complex drainage systems, all absolutely essential. The big question for us, then, is how do we actually see the traffic on these roads? How do we know if everything's flowing smoothly? The answer, of course, is Doppler.
All right, here's our game plan. First, we'll look at the liver's vascular blueprint. Then, we'll dive into the big three, the portal vein, the hepatic artery, and the hepatic veins. After that, we'll see what happens when things go wrong, when flow fails. And finally, I'll wrap up with the key parameters and pitfalls you need to know. Sound good? Let's get started.
Okay, first up, the liver's vascular blueprint. Think of this as mapping the city's highways. Before we look at individual vessels, we got to get the lay of the land. It's all about its unique dual blood supply and its single drainage path. It's actually a pretty elegant system. And the design is, well, it's brilliantly simple when you break it down. You've got two major highways bringing traffic into our liver city. First, the portal vein, that's the big one, hauling in all the nutrient-rich blood from your gut. And second, the hepatic artery, which is like an express lane for oxygen. Then, after all the work is done, all that processed blood leaves through just one main drainage system, the hepatic veins. Now, before we go any further, we need to get the rules of the road straight. It's actually super simple. Hepatopedal means flow is heading toward the liver. Think of it as traffic entering the city. The opposite is hepatofugal. That's flow moving away from the liver. Cars exiting the city. Pedal means toward, fugal means away. Got it? These two words are the foundation for everything we're about to discuss.
All right, let's zoom in on our first major highway, the portal vein. And this isn't just some side street. This is the main cargo freeway, the big one, handling most of the liver's incoming traffic.
So why is it the cargo freeway? Because its job is absolutely crucial. It delivers a whopping 75% of the liver's blood supply, and this blood is packed with all the nutrients that have just been absorbed from the intestines. It's formed where the splenic vein and the SMV meet up, creating this massive superhighway of resources for the liver to get to work on.
And, just like any real freeway, there's a speed limit. For the portal vein, normal, healthy flow, that's hepatopedal flow, should be cruising along at about 16 to 40 centimeters per second. This is a really important number, so you're going to want to lock that one away.
So what does this look like on Doppler? Well, this steady, smooth flow gives us a very specific signal. It's called a monophasic waveform. It's basically a continuous line that just gently waves up and down as you breathe. You can almost think of it as the low, steady hum of traffic flowing perfectly on the freeway.
Okay, on to the second supply line. If the portal vein is the big cargo freeway, then the hepatic artery is the high-speed, high-pressure expressway. And its job is to deliver the most critical package of all, oxygen.
Now, it only brings in about 25% of the total blood volume. But here's the kicker. It delivers almost half of the liver's oxygen. It's what we call a low-resistance vessel, which just means it's built to let blood flow through it easily and continuously, making sure those liver cells never run out of oxygen. And we can actually measure how easy that flow is using something called the resistive index, or RI for short. It's pretty much what it sounds like. It tells us how much the liver is resisting that incoming arterial blood. A normal, healthy liver should have an RI between 0.55 and 0.81. If that number gets too high or too low, it's a big red flag for things like cirrhosis or even transplant rejection. And when you look at the waveform, the difference is, well, it's night and day. Unlike that steady hum of the portal vein, the artery is pulsile. You get this sharp, quick peak when the heart contracts. That's systole. But, and this is key, the flow keeps moving forward even when the heart relaxes. That's the classic signature of a low-resistance vessel that's feeding a super important organ.
Okay, so we've got the two highways bringing everything in. Now, how does it all get out? Well, there's just one drainage path. All of that processed blood leaves our liver city through the hepatic veins.
And the anatomy here is pretty straightforward. You've got three main veins, the right, middle, and left. They collect all the blood from the liver and dump it right into the IVC, the inferior vena cava. That's the body's main trunk line, heading straight back to the heart.
Okay, listen up, because this is absolutely critical. The flow in the hepatic veins is directly tied to the pressure changes in the right side of the heart. This creates this really beautiful, complex waveform we call triphasic.
With every heartbeat, you get 2 forward waves and 1 little backward blip. But when the liver gets stiff, like in cirrhosis, it acts like a sponge, dampening those heart pressures. And what happens? That beautiful triphasic pattern gets flattened out into a boring, featureless monophasic signal. Now, don't confuse this with the good monophasic flow of the portal vein. A monophasic hepatic vein is a bad sign. This loss of triphasicity is a huge red flag.
So, we've seen what normal looks like. The city is running smoothly. But what happens when the whole system starts to fail? This is when Doppler becomes an absolutely indispensable tool. It lets us see the city in crisis.
And this image, it really tells the whole story, doesn't it? On one side, you have a healthy liver. It's an organized city. All the roads are clear. But on the other side, you have cirrhosis. The infrastructure is collapsing. Scar tissue is blocking off all the routes. The result? A citywide traffic jam, a total gridlock with truly devastating consequences.
This massive gridlock has a name: portal hypertension. As all that scar tissue blocks the roads inside the liver, the pressure starts to back up, all the way into the portal vein. At first, the traffic just slows to a crawl. But if it keeps getting worse, the pressure can build up so much that the flow actually reverses direction and starts flowing away from the liver. It becomes hepatofugal. And that is a very, very serious sign of advanced liver disease.
So let's quickly run through the major crises you'll see. For portal hypertension, you're looking for that slow flow, under 16 centimeters per second, and a dilated vein. Portal vein thrombosis, the whole highway is blocked by a clot. You'll see no flow, period. But Chiari syndrome is when the exit ramps are blocked, the hepatic veins themselves. And then there's hepatic artery thrombosis. This one is a flat-out emergency, especially in a transplant patient, and you'll see a complete absence of any arterial signal. It's a code red situation.
Okay, let's wrap this up by putting it all together in a practical operator's manual. We're talking about the key parameters you have to know and the common pitfalls you absolutely have to avoid. All right, here are the numbers you need to tattoo on your brain. Portal vein, velocity between 16 and 40, diameter under 13 millimeters, and the flow has to be hepatopetal. Hepatic artery, RI between 0.55 and 0.81, low resistance waveform. And the hepatic veins, that beautiful triphasic waveform with hepatofugal flow. Seriously, committing these to memory is just not optional. And look, you have to be careful out there. Really simple technical mistakes can lead you down the wrong path completely. A bad Doppler angle will give you a fake velocity, putting your sample volume in the wrong spot. You're going to get a garbage waveform. Always account for how the patient's breathing affects the flow. And remember, anatomy doesn't always read the textbook. Your technique has to be meticulous. It's paramount. So today, we've mapped the major highways of the liver using the tools we have right now. But you know this field is always moving forward, always evolving. So I want to leave you with this final thought. As our imaging technology gets even more powerful, what new, more subtle traffic patterns are we going to uncover? And what will they teach us about the health and disease of this incredible, complex city that lives inside every one of us?